Our Medicare moment today is to help explain how we go about reviewing or choosing a Medicare Advantage plan with our clients. We feel this is extremely pertinent because it is currently the open enrollment period, where those of you who have a Medicare Advantage plan have the option to once again review your current plan and make any changes. This video is not for folks who have a Medicare supplement plan, only for those of you who have Part C, also known as Medicare Advantage. As usual, you're listening to myself, Kim Caldwell, and my partner, Fanny Pacheco. We're both managing partners at our boutique insurance brokerage, PBI Insurance, where we specialize in providing healthcare solutions to seniors. We are based and service Medicare beneficiaries in California, Texas, and Arizona.
Well, first, what is a Medicare Advantage plan? The quick version is that a Medicare Advantage plan is also known as Medicare Part C. These plans offer Medicare-covered benefits through private health insurance plan instead of original Medicare. This means that your Medicare is now being handled by an insurance company. These plans offer coverage that is as good as or better than what original Medicare Part A and B offers. These plans can also offer additional benefits such as vision, dental, and hearing. Most of these plans also incorporate your prescription drug benefits into their plans, which means you do not have to have a separate Part D prescription drug plan.
Second, what is the cost terminology you need to be familiar with when it comes to Medicare Advantage? The premium. These plans can have a monthly premium. This is a premium you might have to pay to the insurance company. Not all plans will have a premium. They will also have coinsurance amounts for various services. What is coinsurance? Well, for example, you might have to pay a coinsurance amount on any durable medical equipment you need. Say you need a wheelchair. The Medicare Advantage plan might pay 80% of the cost, and then you are responsible for the 20% balance. These plans may also have copays for certain services. A copay is different from coinsurance in that a copay is one where you pay a fixed amount, not a percentage. An example might be that you might have to pay a $20 copay for a primary care doctor visit or a $40 copay for an x-ray, as an example. These plans can also have a deductible for certain services. This is a set amount you pay annually before the plan will pay for that service. Lastly, and one of the most important cost components of a Medicare Advantage plan is that all plans will have a maximum out-of-pocket amount. This is the total amount you will pay annually for services within the plan. Any medical coinsurance, copay, or deductible will be included in that amount. And once you hit this number, the plan will pay 100% of your medical services.
While there are several different types of Medicare Advantage plans, we're going to focus on Southern California. The predominant Medicare Advantage plans in SoCal are HMO plans. There are 55 HMO Medicare Advantage plans in Los Angeles County. What is an HMO plan? An HMO plan requires that you get your medical care from providers in the specific plan's network, and you will need a referral from your primary care physician to see a specialist. So one of the very first things we look at is your doctors, any specific specialists, and your preferred hospital. We will need to identify the plans that have your doctors in their network. This is a step that we take very seriously as we need to connect your primary care doctor with your specialist and to your preferred hospital. Unfortunately, sometimes this is a challenging process since different doctors are part of different medical groups. In some cases, all of your doctors or providers may not be in the same network, which means you have a decision to make regarding your specific providers.
Once we're satisfied with having your providers in network, then we take a look at your prescriptions. The copays, coinsurance, and deductibles for each plan is different and depends on the types of prescriptions you specifically are taking. We want to find a plan that offers the best prescription coverage for you. The next step is to look and compare the maximum out-of-pocket amount for these plans that have your providers in network and who have the top prescription coverage for you. There's no reason to go with a higher maximum out-of-pocket plan if all else is satisfied. We'll look at specific copays and coinsurance that make up the maximum out-of-pocket amount to make sure you're not going to be paying for services unnecessarily. Finally, we'll take into consideration any additional benefits. One of the best free benefits we see in these plans is the over-the-counter prescription allowance, where plans give you a quarterly allowance to purchase items such as cold and allergy medicine. Other benefits that might weigh heavily in our decision is that if you're looking at incorporating a dental plan or hearing benefits. And of course, there are other nice-to-have benefits that some plans offer, such as transportation or acupuncture.
Typically, there are 2 to 3 plans that will rise to the top for you, and we highlight the benefits in order for you to make a decision. This is an extensive process we go through in order to ensure you are getting the right coverage for the right price. The more you are open about what you need and require from your plan, the better your agent will be able to help you navigate the many different Part C Medicare plans available. We definitely see a lot of advertising and gimmicks to entice you to a certain plan or insurance company. We recommend aligning yourselves with an agent or broker who has a broad spectrum of insurance plans that they can represent. This is an important factor. In order to sell you a specific plan, your broker, us, needs to not only be contracted with the insurance carriers, we also have to certify to sell the specific Medicare product they have. If all you speak to is an insurance company or agent who only has a couple of options to show you, then you are not getting the full picture. You are not alone in this decision-making process. It does not cost you any money to talk to an agent or a broker. Please do not hesitate to reach out to myself or Kim with any questions with regards to this presentation.